Welcome to Guide Mia. Today we're going to talk about creating a case together on cympha from the chair to the lab. Most dental practices run on two pairs of hands. The assistant seats the patient, takes the photos, captures the scans. The doctor walks in, examines, and decides. The hard part has always been the seam between them, the place where one person retypes what the other already did. This is how cympha closes that seam, all the way from the chair to the lab. Think about where a case actually loses time. Not the dentistry, the plumbing around it. The same patient details keyed in twice. Scan sent and one more email. A photo nobody can find. And at the end of the day, someone reconstructing what happened from memory. None of that is care. All of it is friction, and it lives in the handoff between your two pairs of hands. cympha is built around the division you already have. Your assistant owns the inputs, the demographics, the photos, the scans. The doctor owns the thinking, the exam, the diagnosis, the plan. Each person works on the part they actually own, and nobody retypes the other's work. The patient is never asked the same question twice. It starts before the patient even arrives. Your assistant opens the case from the next name on the schedule. From that moment, the case is a magnet. Every photo, every scan, even a snapshot sent from a phone, all of it lands here on its own. Nothing to sort, nothing to attach by hand. Now the doctor walks in, and the whole picture is already on screen. They examine, pick the template that matches the case, and speak, typing as they go, or letting the assistant scribe. Then one pass reads what they wrote and organizes it. Tooth-numbered findings, diagnoses, options. It never adds anything the doctor didn't say. The doctor is doing diagnosis, not data entry. A checklist sits to the side, quietly tracking what a case like this should have. Green when it's covered, flagged when it isn't. A glance, not a gate. It never blocks care. It just means the documentation is finished when the visit is finished, instead of piling up for after hours. When the plan is ready, the doctor shares it, and what the patient reads is written for them, in their words, and it looks like your practice. They approve from their phone. Here's the quiet safeguard. The patient sees a frozen copy of exactly what you sent. Change the plan after they approved, and cympha clears that approval and records why. Nobody is ever bound to a document they never saw. Everything from that visit, demographics, photos, scans, notes, both plans, the patient's answer, lives on one case. The record is written once, and the case keeps its own log, an append-only history of who did what and when, so no one has to reconstruct the story later. That's peace of mind you never have to think about. If the treatment needs a lab, one click branches the case. The patient details, the files, and the doctor's full reasoning all travel with it. The lab starts for what you decided, not a one-line brief. You connect with your own lab first, then send the case their way. Fewer questions coming back. Less rework. A case that arrives already understood. That's two-handed case creation on cympha. One record, written once, from the chair all the way to the lab. The full step-by-step is waiting for you at cympha.com in the cookbook section. See you in the next cookbook.